Question 1. A client with COPD is receiving oxygen at 4 liters per minute via nasal cannula. Which action by the nurse is most appropriate? A. Increase the oxygen to 6 liters per minute if saturation drops. B. Encourage the client to breathe faster. C. Assess for signs of CO2 retention and notify the provider. D. Discontinue oxygen to prevent oxygen toxicity. Answer. C. Assess for signs of CO2 retention and notify the provider. Question 2. A patient is admitted with suspected tuberculosis. What is the priority nursing intervention? A. Administer 4 antibiotics as prescribed. B. Place the patient in airborne isolation. C. Notify the infection control department. D. Perform a skin test immediately. Answer. B. Place the patient in airborne isolation. Question 3. A client with asthma is experiencing wheezing and shortness of breath. What should the nurse do first? A. Call the rapid response team. B. Encourage coughing and deep breathing. C. Administer a prescribed short-acting bronchodilator. D. Notify the healthcare provider. Answer. C. Administer a prescribed short-acting bronchodilator. Question 4. Which task is appropriate to delegate to a UAP for a client with pneumonia? A. Assess lung sounds every 4 hours. B. Teach the use of incentive spirometer. C. Assist the client with ambulation to the bathroom. D. Monitor oxygen saturation levels. Answer. C. Assist the client with ambulation to the bathroom. Question 5. A nurse is caring for a patient with a chest tube. Which finding requires immediate intervention? A. Drainage of 100 milliliters over 8 hours. B. Constant bubbling in the water seal chamber. C. Fluctuation with inspiration and expiration. D. Occlusive dressing over the insertion site. Answer. B. Constant bubbling in the water seal chamber. Question 6. The nurse prepares to suction a tracheostomy. Which action ensures patient safety? A. Suction for at least 20 seconds continuously. B. Hyperoxygenate the patient before suctioning. C. Apply suction during insertion of the catheter. D. Use clean gloves for the procedure. Answer. B. Hyperoxygenate the patient before suctioning. Question 7. A nurse is assigning patients. Which client should be assigned to the LPN? A. A new admit with respiratory distress. B. A client requiring discharge teaching. C. A stable client with COPD requiring a nebulizer treatment. D. A client needing IV morphine for severe pain. Answer. C. A stable client with COPD requiring a nebulizer treatment. Question 8. A post-op patient with a history of sleep apnea is receiving opioids. What is the nurse's priority? A. Monitor pain levels hourly. B. Encourage frequent position changes. C. Monitor respiratory rate and oxygen saturation. D. Keep the head of the bed flat to prevent dizziness. Answer. C. Monitor respiratory rate and oxygen saturation. Question 9. Which assessment finding indicates a need for immediate intervention in a patient with asthma? A. Wheezing heard throughout all lung fields. B. Respiratory rate of 24 breaths per minute. C. Silent chest with use of accessory muscles. D. Peak flow at 80% of personal best. Answer. C. Silent chest with use of accessory muscles. Question 10. A nurse is caring for a patient with pneumonia. What action should be prioritized to improve oxygenation? A. Administer prescribed antipyretics. B. Encourage fluid intake. C. Assist with incentive spirometry use. D. Provide small frequent meals. Answer. C. Assist with incentive spirometry use. Question 11. A client has a new diagnosis of lung cancer. Which statement by the client requires priority follow-up? A. I'm worried about the treatment plan. B. I feel like there's no reason to keep trying. C. Will I lose my hair from chemotherapy? D. Can my family stay with me overnight? Answer. B. I feel like there's no reason to keep trying. Question 12. A patient with a tracheostomy coughs and dislodges the tube. What is the nurse's first action? A. Call the physician immediately. B. Insert a new sterile tracheostomy tube. C. Provide oxygen via face mask. D. Use a bag valve mask to ventilate the patient. Answer. B. Insert a new sterile tracheostomy tube. Question 13. Which of the following indicates effective teaching to a patient with newly diagnosed asthma? A. I will take my rescue inhaler every morning. B. I will avoid exercise to prevent attacks. C. I'll monitor my peak flow every day. D. I should only use my corticosteroid if I'm wheezing. Answer. C. I'll monitor my peak flow every day. Question 14. A patient has a pneumothorax and chest tube drainage system. What should the nurse report immediately? A. Absence of fluctuation in the water seal chamber. B. Serosanguinous drainage of 75 milliliters in 8 hours. C. The chest tube is below chest level. D. Patient complains of mild chest discomfort. Answer. A. Absence of fluctuation in the water seal chamber. Question 15. A nurse auscultates coarse crackles in the lower lobes. What is the most appropriate initial action? A. Notify the physician immediately. B. Encourage the patient to cough and deep breathe. Clear the airway immediately. D. Document the findings and reassess in 1 hour. Answer. B. Encourage the patient to cough and deep breathe. Question 16. A COPD client is drowsy and difficult to arouse. What is the nurse's first action? A. Administer naloxone. B. Increase the oxygen flow. Check arterial blood gases. D. Reduce environmental stimuli. Answer. C. Check arterial blood gases. Question 17. Which action should the nurse take first for a patient with acute respiratory distress? A. Administer prescribed antibiotics. B. Raise the head of the bed. C. Start IV fluids. D. Call respiratory therapy. Answer. B. Raise the head of the bed. Question 18. Which statement by a UAP indicates a need for more teaching about oxygen safety? A. I will not smoke near the oxygen tank. B. I will keep the oxygen tubing free of kinks. C. I will adjust the oxygen flow if the patient feels short of breath. D. I will check that the tank is secured safely. Answer. C. I will adjust the oxygen flow if the patient feels short of breath. Question 19. A patient receiving high-flow oxygen develops confusion and tremors. What should the nurse suspect? A. Pulmonary embolism. B. Respiratory acidosis. C. Oxygen toxicity. D. Pneumothorax. Answer. C. Oxygen toxicity. Question 20. The nurse is caring for a client with epiglottitis. What is the priority nursing action? A. Assess temperature and provide antipyretics. B. Prepare for possible intubation. C. Administer antibiotics as ordered. D. Encourage fluid intake and monitor I and O. Answer. B. Prepare for possible intubation. Question 21. A patient with pulmonary embolism is anxious and short of breath. What is the nurse's priority action? A. Offer emotional support. B. Lower the head of the bed. C. Apply oxygen via non-rebreather mask. D. Call the provider immediately. Answer. C. Apply oxygen via non-rebreather mask. Question 22. Which finding indicates a complication in a client receiving mechanical ventilation? A. Synchronized breathing with the ventilator. B. Elevated peak inspiratory pressure alarm. C. Moist mucous membranes. D. Equal breath sounds bilaterally. Answer. B. Elevated peak inspiratory pressure alarm. Question 23. A client with COPD is on home oxygen. Which statement requires follow-up teaching? A. I'll check the oxygen tubing for kinks. B. I'll use Vaseline in my nose if it gets dry. C. I'll avoid smoking around the oxygen tank. D. I'll wear the nasal cannula as directed. Answer. B. I'll use Vaseline in my nose if it gets dry. Question 24. Which assessment requires immediate action in a post-op patient with thoracotomy? A. Pain rating of 6 out of 10. B. Respiratory rate of 26 breaths per minute. C. Tracheal deviation to the right. D. Decreased breath sounds on the surgical side. Answer. C. Tracheal deviation to the right. Question 25. A nurse enters the room and finds a patient with asthma unable to speak. What is the priority action? A. Obtain a pulse oximeter reading. B. Give the prescribed corticosteroid. Commander administer a rescue inhaler. D. Prepare for emergency intubation. Answer. C. Administer a rescue inhaler. Question 26. Which client can be safely assigned to a float nurse from a surgical unit? A. A newly diagnosed TB patient. B. A client requiring teaching about inhaler use. C. A stable COPD patient needing pulse oximetry. D. A patient in respiratory distress with ABG changes. Answer. C. A stable COPD patient needing pulse oximetry. Question 27. A nurse is caring for a patient after bronchoscopy. Which findings should be reported immediately? A. Blood-tinged sputum. B. Mild sore throat. C. Absent gag reflex. D. Stridor and respiratory distress. Answer. D. Stridor and respiratory distress. Question 28. What is the most important action when preparing a patient for thoracentesis? A. Obtain baseline lung sounds. B. Position the patient upright and leaning forward. C. Administer pain medication. D. Teach the patient to take deep breaths. Answer. B. Position the patient upright and leaning forward. Question 29. A nurse is reviewing ABG results. Which value indicates respiratory acidosis? A. pH 7.48, PaCO 230 millimeters of mercury. pH 7.32, partial pressure of carbon dioxide 50 millimeters of mercury. C. pH 7.35, PaCO 240 millimeters of mercury. D. pH 7.46, PaCO 245 millimeters of mercury. Answer. B. pH 7.32, PaCO 250 millimeters of mercury. Question 30. A nurse is caring for a client with ARDS. What is the expected treatment priority? A. Encourage fluid intake. B. Administer bronchodilators. C. Provide high-flow oxygen and prepare for intubation. D. Monitor temperature every 2 hours. Answer. C. Provide high-flow oxygen and prepare for intubation. Question 31. A nurse notes subcutaneous emphysema around a chest tube site. What should the nurse do? A. Remove the chest tube immediately. B. Document the finding and continue monitoring. C. Notify the provider immediately. D. Clamp the chest tube to stop the leak. Answer. C. Notify the provider immediately. Question 32. A patient with pneumonia is confused and restless. What is the best interpretation of this change? A. The patient is dehydrated. B. The patient has a worsening infection. Cerebral hypoxia is impairing cerebral function. D. The patient is fatigued and needs rest. Answer. C. Hypoxia is impairing cerebral function. Question 33. Which instruction should be included in discharge teaching for a patient with asthma? A. Use your corticosteroid inhaler only when you feel symptoms. B. You can ignore mild wheezing if you feel fine. C. Always rinse your mouth after using steroid inhalers. D. Increase activity when your breathing improves. Answer. C. Always rinse your mouth after using steroid inhalers. Question 34. Which action should the nurse take first when the ventilator high-pressure alarm sounds? A. Call the respiratory therapist. B. Check the airway for obstruction or kinked tubing. C. Increase the alarm threshold. D. Administer sedation. Answer B. Check the airway for obstruction or kinked tubing. Question 35. A patient develops sudden shortness of breath in cyanosis. What is the priority nursing action? A. Notify the provider. B. Position in high Fowlers and apply oxygen. C. Increase fluid rate. D. Ask the patient to cough forcefully. Answer B. Position in high Fowlers and apply oxygen. Question 36. Which finding indicates effective response to bronchodilator therapy in a client with asthma? A. Increased respiratory rate. Bilateral clear breath sounds. C. Wheezing persists on auscultation. D. Use of accessory muscles continues. Answer B. Clear bilateral breath sounds. Question 37. Which instruction is essential when teaching a patient about peak flow meter use? A. Use it only when symptoms are present. B. Exhale into the meter slowly and gently. C. Use the meter after taking your medication. D. Measure your peak flow at the same time daily. Answer D. Measure your peak flow at the same time daily. Question 38. The nurse is preparing a client for a VQ scan. Which action is most important? A. Explain the test involves radiation. B. Ensure the patient is NPO for 8 hours. C. Start IV fluids prior to the scan. D. Remove all metal jewelry. Answer A. Explain the test involves radiation. Question 39. What is the nurse's priority action for a patient with status asthmaticus? A. Administer a short-acting beta agonist. B. Teach pursed lip breathing. C. Monitor peak flow readings. Doctor, prepare the patient for discharge. Answer A. Administer a short-acting beta agonist. Question 40. A nurse is caring for a post-op patient with atelectasis. Which intervention is most effective? A. Encourage fluid intake. B. Reposition every 4 hours. C. Instruct to use incentive spirometer hourly. D. Limit physical activity. Answer C. Instruct to use incentive spirometer hourly.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.